Good to see you all. I'm going to give everyone just a second to get connected, get their screens popped up for those who are going to turn their screens on. I love seeing your faces. It's so good to see everyone today. And we're glad to have you joining us for this program. It's an exciting program. We've had a lot of people interested in it, and we're going to be joining us. So we encourage you to ask your questions throughout the program today via chat. So if you would just hover at the bottom of your screen and pop open your chat box, that's going to be where you can ask your questions. This is going to be conversational style today. So we will kind of intersperse your questions along with our conversation, especially if it's relevant to what we're talking at that moment. And I'll kind of be checking for those and making sure that we can get to as many of them as possible. I know we have 1 hour to cover a whole lot of content that is very interesting to a lot of people. And so I'm going to go ahead and kick us off and first introduce myself. I'm Anissa Mitchell with PMD Alliance. And with us today is Dr. Robert Bibeau, and I'm excited to have him with us. And I want to give you a little bit of background, and I know he will too. And yes, give us a shout out because I want to hear where everyone is from. So thanks to the person in Toronto who just gave us that shout out. So Dr. Bibeau is actually a previous Marine Corps captain and infantry, okay, I cannot talk already, infantry officer, and was deployed in Iraq and wounded in action in 2008. He is a Purple Heart recipient and also a Medal of the Global War on Terrorism service. So I am honored to have someone who served in that way to join us, but this is a part of his story. So I would like first, before we dive into actually getting into what even the wind means, because we referenced that in our title today, is if Dr. Bibeau, if you would spend a few minutes talking about how you got into Eastern medicine and how this happened from your time of being injured in Iraq. How did this lead you into?
Yeah, sure. I think that's a really good place to start. Good morning, everyone, or good afternoon, or even, whatever time it is of day for you. So, I'm really glad to have everyone on. I got into East Asian medicine practices because after I was wounded in 2008, so I had a traumatic brain injury and 7 herniated discs in my neck and spine as a result of an IED blast, which you've heard of as like roadside bombs is like another common name for them. While I certainly wasn't hurt as bad as a lot of guys, my injuries were certainly significant enough that I was pulled out of the theater of operations, and that started a recovery timeline, which to my mind is still ongoing, right? I don't know that you ever really fully recover from a thing like that, right? You can be broken in body and mend, but you also stay broken in spirit for a very long time. And that was certainly the case for me. And being in medicine actually, I think, is helping in terms of both being, healing in body and in mind and spirit. As I was recovering from my injuries, I was at Wounded Warrior Battalion West, which is at Camp Pendleton, California, and was recuperating there. And I began a really robust study of Chinese Kung Fu, Tai Chi, and Qigong, which there's 8 branches of Chinese medicine, and you could consider the physical exercise or physical therapy branch to be Kung Fu, Qigong, and Tai Chi. And so I had focused on that as an alternative therapy, and that got me started, or made me aware, tangentially at least, of Chinese medicine in terms of acupuncture and herbal remedies and things like this. When I got out of the Marine Corps in 2013, I opened a Kung Fu school in Albuquerque. And I mean, within weeks, I realized that all of my students were really more like patients. They all were recovering from some sort of something or other. And I kind of hypothesized that it was my own experience and things that I was able to bring to the table as a teacher that really permitted that. But because each of them were recovering from some sort of something or other, it really made sense to, if I was going to serve that community, to not have any half measures. And I realized that because the highest levels of Kung Fu are medicine, specifically Chinese medicine, I decided to seek a Chinese medical school. There was one in Santa Fe. And for the next several years, I continued to operate my business, but also treated Chinese medical school as a full-time job, while also being a full-time dad. So that's really what brought me into the medicine.
Fantastic. So we hear a little bit about Eastern medicine here and there. How is this different? How's the approach different when you meet with the patient? You know, your assessment process. Can you explain how it varies compared to Western medicine?
I can try. So the Chinese medical approach, the entire worldview, in a phrase, is a world away. And the traditions that inform how a Chinese medical doctor, a doctor of Oriental medicine, right? So we try to be careful about using the terms Chinese medical doctor or something like that. But a practitioner of Chinese medicine, the manner in which we diagnose is informed by about 5,000 years or more of clinical experience and practice. And so the diagnostic lenses that we use are filled with things that to the Western mind might sound like, just poetic phrases that really smack of a charlatanism, but that's absolutely not the case. The diagnostic methods are actually logical and coherent throughout the entire system and practice and worldview that is Chinese medicine. So when I bring a patient in, my diagnostic lens, it involves everything from there's basically what we call 4 pillars of diagnosis. So, I'm going to observe, I'm going to auscultate, so I'll listen. There, olfactory aspects. So, how does the patient smell? Like that's a thing that surely is appropriate in other medical realms, but it's one that we focus on, right? And there's many of these: palpation. That's not all that different from what you're going to experience if you go to a Western provider. If you're experiencing diabetic shock, like we all know, like a diabetic patient has a certain smell to them, a fruity smell. So these things aren't really necessary. And that's just one example, by the way. Like if you come to me, I'm not just taking a sniff and being like, got your diagnosis, right? That's not really how it works. But we're going to look at your tongue and we're going to make assessments about the status of your organs and organ health based on what kind of features we may see on your tongue. And that seems like something that's relatively foreign, because it is. It's like it's an entirely different worldview, coming from an entirely different culture and nation state from thousands of years ago, when instead of being able to look internally with an X-ray, we had to observe the surface of the body to make these determinations. And again, that's not necessarily all that different from what you'll find in Western medicine, right? Like when you start to see a jaundiced patient, it's like, well, you probably got something going on with your liver. That's not all that dissimilar or surprising. Meanwhile, the terminology and the understanding of human physiology to the Chinese mind is wildly different. So, for example, with what we're going to be discussing today, in Parkinson's or Parkinsonian-like disorders, invariably to the Chinese mind, it presents as what we call wind, and wind can have a variety of manifestations, but they will always be related to the liver, always. Now, you get a patient that says, wait a minute, what is wrong with my liver? Well, biomedically, probably nothing. But from the Chinese perspective, the liver system, or the perception through the Chinese view of what the liver is responsible for, those may have a variety of issues. So it is a vastly different diagnostic system, and yet it's very, very similar. And in many respects, much of Western tradition actually probably does, in fact, derive from Chinese traditions, because these traditions are so very old.
All right, you referenced the wind. So Chinese medicine approaches things from the different elements. So could you review the different elements and what they mean?
Yeah. So, and that's actually only going to be one aspect of the diagnostic lenses, right? So like the 5-element system, it's part of the worldview that informs everything else, right? And before we can really talk about the 5 elements, we actually have to talk about yin and yang. A lot of times it's pronounced yang. we tend to say yang. So we have to talk about yin and yang, and we have to talk about qi. And qi is not some sort of mystical energy force like you're Yoda lifting an X-wing out of the swamp to impress Luke Skywalker, right? Like qi is actually, it could be better defined than energy as matter. And yin and yang are definitions of the state of that matter relative to other states of matter. And a thing might pertain more to yin or more to yang. And everything in the Chinese mindset is categorized into, is it yin or is it yang? But it will always be both. It's never or, it's yin and yang, and it always will be, but it might pertain more to one or the other. So like water as a liquid pertains to yin, but water in a gaseous state is extraordinarily yang, right? And we actually see this same phenomena described in to the Western mind in terms of states of matter, right? So water in a gaseous state of matter, the particles are wildly diffuse. And this is actually the same manner of perception that you have in the Chinese view. It's just different terms, right? Words mean things, but they mean different things to different people in different cultures. So when we break down into the 5 elements, that ends up being the next extrapolation of this idea of yin and yang. So what you have, it's not 5 elements as though it's building blocks of matter, like we would see with the periodic table of elements, or even the Greek perception of the elements of, earth, air, wind, and water, or fire, earth, air, wind, whatever it was, right? Not great on the Greek side, I guess, but this idea of elements is actually different in the Chinese view, at least in terms of medicine, because rather than being building blocks, it's categories, right? And the cycles relative within the 5 element system are a definition of relationships between these categories. And each of the 5 elements of wood, fire, earth, metal, and water, they all generate one another, they control one another, they can insult one another. And so if you try to diagnose exclusively through a 5 element, and there are acupuncturists and herbalists and doctors of Oriental medicine, which do sort of prefer a 5 element modality or a 5 element system, and they get great results, right? Because again, this interpretation is logical and consistent throughout the system. It's not, just because it's old doesn't make it antiquated, and it doesn't make it out of date, right? Because a thing is new does not make it better. But the 5 element system is an older method of looking at the body, but again, it's looking at it through these various relationships, and it later informs later developments within Chinese medicine, which some of them that are younger, younger developments might be 2,000 or 3,000 years old, right? So it's kind of a question of what's a new system in Chinese medicine. So what we have when we look at the 5 elements is how do these relationships between wood, fire, earth, metal, and water, how do they relate to one another? And what kind of category or what kind of phenomena in the universe? Because to the Chinese mind or the Chinese medical practitioner's mind, all phenomena in the universe will be categorized in one of those 5 elements, and then will further pertain either predominantly to yin or predominantly to yang. So for example, the element wood would have a correlation or a relationship with the what's known as zong fu, which is the organ, like the organs of the body. So like meridian therapy and acupuncture is different than organ therapy. Like they're related to one another, but they're not the same thing. But the element would pertain both to the liver meridian and the liver zong, which would be the liver organ. Fire, for instance, would pertain to the heart and the small intestine, as well as the pericardium and what they call the sanjiao, or the triple warmer, which the triple warmer is not an organ that has a direct corollary to Western medicine. This further extrapolates down by each organ, which is categorized in one of these elements, has a further refinement by also discussing like, okay, well, which sensory organ is affiliated with one of these elements. So like the eyes are affiliated with the liver. And again, we actually see a corollary to this in Western medicine, because, reference a jaundice patient, like I mentioned before, like, if somebody's got liver disease, you will often see jaundicing of the sclera, or the eyes will start to turn yellow, right? And we even see like anger is the emotion associated with, because every phenomena in the universe falls into one of these categories of elements. And anger would be the emotion that categorizes with wood. And we see this even in art and literature, where like villains are often depicted with yellow eyes, right? So these phenomena, they're not necessarily foreign to the Western mind. In fact, they're often very, very intuitive. But again, words mean things, and they mean different things to different people in different cultures. I think I kind of answered the question on 5 elements there. It's a lot to follow, but
You did, and it's very fascinating because I've heard of, well, and we referenced the wind from within in the title. And so I've heard of the different elements, really wasn't sure how that works. So if we were going to talk about wind, and I know you mentioned this a little bit, but what does that mean in relationship to Parkinson's? Why is it called
yeah,
wind?
that's Anissa, that's a really good question. So within further developments of the practice of this medicine, because this 5 elements model and idea, it's ancient. It's older than the 5,000-year mark for a lot of what we find elsewhere in Chinese medicine. And later developments started to identify, well, what are the mechanisms of disease? How does disease occur? And again, like they weren't really able to sort of define, like through a biomedical position of like kind of taking their microscope and taking a deep look at something and identifying, oh, you got a little bacteria coming in or something like this, right? Now, fascinatingly, one of the characters for disease with wind pathology actually has like a little bug, right? Is like what it looks like in the Chinese letter or Chinese character. So it's kind of like fascinating, because it's like, wow, this, what were they thinking about, right? Now, the mechanisms of disease in Chinese medicine come from, they're really fairly limited. So you have heat, you have cold, you have damp, you have phlegm, which phlegm might be like the kind of stuff that you cough up, but it could also be other abnormal growths, right? So not necessarily cancer. That's not necessarily what I'm saying, although it could be, right? But so phlegm can be substantial or insubstantial, right? Like, have you ever had something like kind of caught in the back of your throat and you can't spit it out, you can't swallow it, it's just there? That would be considered an insubstantial phlegm, right? It's one that you can't see, but you feel it, it's there. And we actually even have a name for this phenomena in Chinese medicine of plum pit qi, right? It's fascinating, actually. Like General Grant, former president of the United States after Civil War, when he first got sick with throat cancer, the first thing he described was a sensation like he had a peach pit stuck in his throat, right? This is like fascinating, because the man had what the Chinese mind would call phlegm, and it initially was an insubstantial phlegm, and it later killed him, right? So it's like this is fascinating how these terms for disease mechanisms in Chinese medicine are really intuitive, and it was designed this way. It was designed so that the layperson could hear these terms and understand what was occurring with them, which to my mind is something of an advantage in Chinese medicine, because after I was wounded, I would wake up in the mornings and my hands would have gone numb, and they were experiencing this pins and needles, and it was actually relatively painful, and it would take sometimes hours before I could get feeling back in my hands. And it turns out that I had a disc herniation which was impinging the C7 and C8 nerve. So I basically was experiencing an ulnar neuropathy, which actually originated in my neck. And the term that I used when I initially spoke to my neurologist was, my hands go to sleep. I didn't know that I needed to use a specific term for my neurologist to kind of, because you're throwing these symptoms at your physician, and it's all these terms, and you got a lot going on, and you have only a few minutes to talk to them, because there's a lot of other sick people too, and they're human, and they may miss hearing a term that by rights they probably should pick up on, but they can miss it. And had I known I needed to say pins and needles, I probably would have had a diagnosis for what was going on with my hands and treatment for it a whole lot earlier. So an advantage in Chinese medicine is that these terms that we use are really familiar intuitively, and you don't necessarily have to be Chinese either, right? So the idea of wind as a disease mechanism in Chinese medicine, it can be either exogenous wind, which would be like, and that's the character, that's the type of wind that the Chinese character has, the little character for like a bug, like a virus or a bacteria. They're kind of like referencing like an insect with it, but you also have endogenous wind that is coming from within your body. And there's various reasons why this wind may occur. But the wind is something that is recognizable, so recognizable, in fact, that when James Parkinson wrote his paper in the early 1800s, he called it On the Shaking Disorder. And if you watch a tree that is in a windstorm, it shakes, right? And so somebody who has a movement disorder, they're going to have that tremor and they shake. And these ideas of shaking disorders are, they are ancient and they go way back. There's medical models or medical descriptions of what is Parkinson's going back thousands and thousands of years.
So I know you referenced different modalities that are used in Chinese medicine. And I wonder if you could spend a little bit of time talking about those and how those might be of benefit to someone with Parkinson's, whether it's a physical thing or even how maybe mood and emotions can play into it. So could you talk a little bit about that? Because I think people know a little bit about acupuncture. We've had different people talk on acupuncture, but there's more than just that modality, as I understand it. So could you explain that a little bit?
Yeah, so that's a great question. So depending on who you talk to, there's either 5 or 8 treatment modalities or sort of branches of Chinese medicine. And in that, you're going to have things like meditation, right? So you could focus on prayer, for example, and that's considered to be a big one. Also, you're going to have nutrition. Again, this is not particularly dissimilar from what we find in Western medicine. Additionally, you're going to have, so like the surgical intervention that you'll find through Chinese medicine is acupuncture. But we've got herbal medicine, which these are often quite powerful and potent substances. You can absolutely have herb-drug interactions that can be quite dangerous for you. And sadly, many of these substances are available just through your local vitamin cottage or something like that. So it's definitely important, if you're taking those substances, have them reviewed by a physician. Doctors of Oriental medicine tend to be very good at assessing that for you. You're going to have things like exercise, right? And for us, it's Kung Fu, Tai Chi, and Qigong. Now, fascinatingly, there was a paper done a few years ago. I can't remember. I'm losing the name of the authors of the paper, but they looked at, for Parkinson's in particular, what kind of dosage of exercise was effective, because it was found that exercise was a very effective means for helping to moderate the effects of Parkinson's as it advances. Now, they weren't looking at like, how do you integrate things like other branches or other aspects of Chinese medicine, but they did take a look at Tai Chi, right? Which is fascinating, because the thing that they were looking at specifically was, how do you dose exercise, right? We all understand like how you're going to dose your carbidopa and levodopa, but how do you dose proper amounts of exercise? Well, the Chinese figured this out eons ago by identifying sets of movements that you could practice through a Tai Chi form or a Qigong form. And that form might take, it might be a 98 movement form, but for you to do it might take 20 minutes. And that's your dosage, is this 20-minute dose of this, this experience of going through that form or that routine of your Tai Chi or your Qigong. Right? In terms of how acupuncture might work, now this is fascinating. And a lot of this is going to be nothing this is nothing new to probably most of the people on this call today. So when you look at the effects of carbidopa, levodopa, which is absolutely, when your Parkinson's is advancing, there's no replacement for the drug, right? There's no amount of acupuncture that I'm going to do or one of my peers is going to do that is going to have you not need your medications once you've reached that point that you need them, right? Once the disease is advanced. Now, I think it's 50% of patients at the 5-year mark have developed such a significant tolerance that they're not going to really get a very tremendous benefit from the drug of choice, the most effective tool that we have in the fight against Parkinson's. So where can something like acupuncture play a role? Well, Acupuncture is through a biomedical lens effective for, there's several, the mechanism of action is not necessarily well understood all of the time. There are things where we look at it and we say, well, it's very effective at releasing endogenous opiates, endorphins, dynorphins, and enkephalins in particular. But it also has a very good ability to promote the release and uptake of dopamine. And therefore, you get a good effect of moderating the dopamine and acetylcholine imbalance that is at the root of most movement disorders. So, and this doesn't matter if it's restless leg syndrome or a Parkinsonian disorder of some variety, or even like an essential tremor. Now, when it comes to like a detox tremor or something, that's different, but we still are often very effective. So what we're able to do through integrating care through sort of alternative means like through Chinese medicine and acupuncture in particular, you get to stave off the amount of time before you start to have the degradation of the effect of your carbidopa and levodopa. So these are reasons why acupuncture would be very effective, and why you have better patient outcomes with integrated care. But you do have to be aware of a charlatan, right? Because they are everywhere in medicine, whether it's Eastern or Western or anywhere, right?
So with acupuncture, it can treat a variety of different symptoms that someone might experience with Parkinson's. So tremor, there could be rigidity of muscles and pain related to that, sleep issues. Could you talk a little bit about that? And then I know someone did ask, because you referenced it, which approach, and I'm assuming they mean in terms of acupuncture, like where maybe the needles go or how that works to promote the release and uptake of carbidopa, levodopa. So I know I just put a bunch of questions in there. So maybe answer that and then talk a little bit about some of the other symptoms and how you would approach that with acupuncture.
As far as which approach is most effective with reducing the carbidopa, levodopa, is that your question?
Which approach promotes the release of carbidopa?
Yeah, so I would say in particular acupuncture and exercise, right? I mean, take for example, like does exercise release dopamine? Yes, right, and we know this. Now, as your quality of life goes down because you're experiencing the rigidity and things like this, it's like, well, okay, hey, smart guy, how am I supposed to do my exercise? I can barely move. It's like, okay, that's a fair point. Well, as you come in for your acupuncture, we tend to be very, very good. So one reason that now when we do the diagnosis in Chinese medicine, there's 6 or 7 or depending on how you count them, maybe as many as like 15 different what we call patterns of disharmony. And that's how we diagnose. We don't look at okay, you've got the dyskinesia, you've got the tremor, you've got the mask, and other rigidities. Parkinson's. That's not what we do in Chinese medicine. We look at a constellation of signs and symptoms. And so when you see the rigidity, for example, that often is going to be attributed to what we call liver blood deficiency causing wind. And again, like that notion that many of the descriptive terms are allegorical so that the layperson can grasp what's occurring. You could imagine, so I talked about how the element wood is affiliated with the liver, well, and therefore the eyes. Well, the tissue of the body that is associated with the liver and therefore with the element wood is going to be the tendons. And if you were to imagine your tendons as though like ropes on a ship, like an ancient, like a sailing vessel from the age of sail. When that rope starts to get brittle and dry out, is it likely to have more tension upon it and vibrate pretty significantly? Yes, it is, right? And how does that manifest? Well, you'll see it in the manifestation of the vibrating rope. You'll see it in the manifestation of the shape of the sail having a shake or a tremor. This was the allegory that they used to identify, like, hey, when you have liver blood deficiency, which one of the jobs of liver blood, according to the Chinese view, is to nourish tendon. And if it's not doing that, you start to get this wind that's coming from within the body. Now, if you just have blood deficiency that has not yet dried out the tendons. It's almost like you could imagine it as kind of a really seminal author in the Chinese medicine world is a guy named Giovanni Machocha, who passed away a few years ago. But he describes it in his book, The Practice of Chinese Medicine, as though if there's not something to fill the vessels of a body, i.e. blood, if you are blood deficient, which may mean that you don't have enough blood, it usually doesn't mean that you probably have sufficient volume of blood in your body. But again, this is through how the Chinese viewed and described these phenomena without the ability to look into the body with the modern sophisticated machinery that we now have. But if you were to imagine yourself in a subway where there's no train in the tubes, you are able to experience a sensation of wind rushing through that subway. This is something we probably all felt. Like if you've been to the metro in DC, you've felt that before. That is one. So that wind that rushes through, that's sort of an explanation of what is happening in the phenomena if you're blood deficient. So when we diagnose based on these patterns of disharmony, again, the constellations of symptoms that you might have, we're looking at those types of things. And so when we prescribe, needling with acupuncture through certain points, we're going to choose points that are relative to that particular presentation. To the biomedical professional, it's Parkinson's, it's not liver blood deficiency, it's not blood deficiency, it's not liver yang rising, it's none of these other things that the Chinese guys are talking about. It's Parkinson's. Okay, sure. From your worldview, to quote Obi-Wan Kenobi, if I could be so bold to go to Star Wars, from a certain point of view. So for us, it's we look at these things and we differentiate down further than just the tremor or the rigor or the mask. And we look at these other phenomena that are occurring, and then we parse out where we're going to place needles.
Okay, so that is good, because I think that might help us to understand, like, we've got an overarching treatment for Parkinson's from the Western medicine perspective and medications, but from the Chinese medicine perspective, you can really narrow down on certain issues and presentations and use acupuncture as well. And we've had a few questions here in terms of like using herbs. So one person said, my acupuncturist uses herbs to help. And are there any specific herbs or teas?
Yeah. So, and actually I saw another one down here that I thought was really good. So I guess let's start with that one from Reverie. So yes, there are specific herbs and teas. Now, with herbal medicine, Chinese herbal medicine, and in China, they don't call it herbal medicine, right? They just call it medicine, right? They don't call acupuncture Chinese medicine. It's just medicine. But the herbal formulas, we almost never use a single herb on its own for it's known as single effect. We almost never do that. So the formulas that would be used are going to be specific to your presentation. And some of these formulas are relatively young. For instance, there's one called Tianma Goteng, which is it's a Gastrodia and Uncaria vine. Now, I wouldn't recommend that you just pop out into your backyard and pull down a little hook vine and blend it up and drink it, because probably going to be pretty toxic for you, and it's not prepared properly, right? So preparation is significant, but also, like, is this appropriate to your presentation? Tianma Goteng was a formula that was designed in the 20th century, actually. So it's a relatively young formula, and it was designed as an adjunctive therapy. I want to say 1953, but I think it actually could have been earlier as well. For stroke victims. Stroke is invariably an instance of wind, right? So when you see the facial droop from a stroke, and again, this could also be a Bell's palsy. That's wind in Chinese medicine. And so Tianma Goteng is super effective at treating this, remarkably effective. And then you're going to have other formulas that are designed to go to the liver meridian, which is different from the liver organ. So it gets a little dicey, a little complex, and it's hard to say, eat this or drink this tea, because it would really depend on what your particular presentation is. And a qualified herbalist would be the best to kind of answer that for you. So I hope that answers Reverie's question. There was another one here. Kathleen asked, where do the needles go? she's had acupuncture and it hasn't helped. So one thing I would be curious, Kathleen, is did you see an actual licensed acupuncturist or a doctor of Oriental Medicine, or were you seeing a maybe somebody who was practicing dry needling? Because dry needling is definitely the use of an acupuncture practice for sure. It is absolutely acupuncture. They are not different things, but it's usually acupuncture without the full scope. Now when they dry needle into various trigger points and things like that, and they help a patient get relief from pain and things like that, to my mind, it's say, hey, did you get relief? Great, like, good job, both to you and whoever did it. But generally, I would say, you want a qualified acupuncturist or doctor of Oriental Medicine. There is a thought out there that acupuncture does not work for some people. A professor of mine used to say, well, 10% of the population. And I've yet to meet a single person from that 10% of the population in my patient base. So we do know, however, that as a pillar of thought for the treatment of disease in Chinese medicine, you got to have the right diagnosis. And if you don't have the right diagnosis, you probably don't have the right treatment, because acupuncture is not just a process of happy dartboarding where I just throw the needle and wherever it lands, that's where you get it, right? It's acu because it's accurate and it's precise. So much the way a surgeon applies a scalpel, I'm not putting needles in at a place you don't need them. So selection of points is important. And then there's also a question that, if it took you 65 years to get to where you are in life, one treatment and maybe even 20 might not be the thing that resolves all your symptoms. So that's a component as well. So I'm definitely sorry to hear that Kathleen, you haven't had success with acupuncture, but I'd be curious to, kind of be able to review your case a little bit further. Regarding how to treat liver and blood rigidity, this ends up being significant because I may not be doing anything with your actual physiological liver, but rather the construct of thoughts and mechanisms surrounding how the Chinese view the liver, or how the Chinese physician views the liver. And so I would probably apply needles to points like spleen 6, spleen 4, spleen 10, which are all on the lower leg, as well as like heart 7, pericardium 6, maybe lung 10, definitely stomach 36, which is also on those other points are all on the arm, stomach 36, ren 12, which is in the abdomen. And I would take very cautious measures of how do I insert the needle? How do I apply the needle? What gauge of needle do I use for you? So short answer to where the needles are going to be, it would be, again, dependent upon your presentation, and it would be predicated on what that acupuncture point is perceived to do through the Chinese physiological understanding of the body.
So Dr. Bibeau, and I think there was an earlier question about this, like, can you talk a little bit about the needling? Like, is it painful? There's people that have a little bit of a fear that it's going to be invasive.
Yeah, that's a really great question. Actually, I see that Susan and Martha both kind of discussed this a little bit, and it's great. It's great dialogue over there, actually. So your body is absolutely sacred, right? And so if you have this sense that like the insertion of anything into your body, whether it be a needle or anything else, right, is somehow a violation, it's like we're probably not going to get very good effect. But Martha's point immediately below Susan's is that acupressure can be effective. Now there's another ancient idea that in the treatment of disease, so I'm quoting this, in the treatment of disease, there is nothing more effective than a needle. And it's like, well, maybe that's true, right? I don't know that it is. That's a particularly ancient viewpoint. And I've had great success with needling. I've also had patients where, so pediatrics, for example, I generally don't put needles into children because they don't like it very much. And it doesn't matter how thin or how painless the needle is. There's a needle going into their body and it's scary. So I use acupressure, or I use what's known as Tuina, which is massage. And that can be extremely effective. So, perhaps maybe you're not a good candidate because you've got because as you're aging and your skin is beginning to change, or perhaps you bleed very easily because you're on blood thinners or something like this, you don't have to use acupuncture in order to get an effect through Chinese medicine. It is what they call a completed medical system, and it has therefore many modalities. Now, go to somebody who's been vetted, go to somebody who's been licensed and who you can trust that they've done. I mean, like, I've never once gone to my barber and been like, this guy's got a license and I trust him. I just go get my hair cut. But when it comes to a physician, I want to know that you know your stuff. And actually, frankly, I also kind of want to know my barber's pretty good, because my barber could probably make me look pretty stupid if I get a bad haircut. So
It's true. So we've had a couple of people that have asked about the electrical acupuncture. Could you speak on that? There's actually one called Neuropuncture. So if you're familiar with that, but could you talk about the difference between the two?
Yeah. So they're not different, right? They're the same thing, and one of them has a relatively modern mechanism applied to it, right? So when we apply an electrical current to the needles, so we usually go with a microcurrent followed by a milliamp. And there's one of my professors was, I consider him, and many consider him to be absolutely an expert on Estem acupuncture. And I tend to use Estem treat predominantly in the treatment of physical trauma. So like if I'm treating somebody who's had, I don't know, torn muscles or tendons, or is recovering from a surgery, or maybe broken bones, something like that, car accident, right? Something like this. That's when I tend to use Estem acupuncture or neuropuncture techniques. And again, these can be synonymous. Neuropuncture is, my understanding of neuropuncture is that it's utilizing the Estem acupuncture techniques with a very specific set of goals in mind. So for instance, another example of that, not Estem, would be what's known as battlefield acupuncture, which is a practice of inserting needles into the ear, so auricular acupuncture, and it's been used for everything in the treatment of PTSD to severe physical pain, right? So you will find specific modalities in Chinese medicine, or in its sort of like the mechanisms where it's either sort of borrowing from our practices, where there's specific goal sets for what that treatment modality is trying to affect. But in general, Estem is simply the passing of current through the body between 2 points that have been selected by the application of a needle. It is different from like a TENS unit, but it's in essence a very similar sort of treatment mechanism. Estem can be very, very good at promoting a perfusion of blood to a region in order to promote healing. So, and in blood, when I say blood in this context, I'm talking about the, sort of the Western biomedical understanding of blood, right? So we're in essence promoting a massive vasodilation to promote fresh blood flow, flush out, dead tissue, introduce macrophages to the region, things like this.
So you mentioned PTSD. Is acupuncture helpful in treating other issues like anxiety, depression?
Without a doubt. So one of these very old maxims of the medicine is that it's the idea that all internal disease comes from the emotions, right? So the Chinese worldview is that, and again, this is one that is very familiar to us as just as individuals and humans. And so it's where these ancient poetic sounding terms that are sort of quaint end up being really useful in our everyday life. It's also where you get sort of these mysticism aspects that I think are fairly dangerous to the medicine. Because I'm not Jesus, so you're not going to come in and I'm going to lay hands on you and you're going to be healed. I mean, maybe there's that power out there, but I haven't done it yet. So in the treatment of anxiety, depression, I've worked recently with some young mothers that are suffering from postpartum depression. I work with many veterans who are suffering from PTSD, and I work with many patients who are not veterans who are suffering from PTSD. I work with patients who are the spouse or caretaker of someone living with Parkinson's or dementia or something like this, where they're having their own series of really traumatic experiences that are very difficult to live through. And acupuncture has been demonstrated to be over 5,000 years. And then through recent scientific research, particularly when you look at integrating with conventional care, very good patient outcomes for every disease mechanism of this kind.
I'm so glad you brought the care partner perspective to that, because there is a lot of stress and anxiety and grief and other emotions wrapped up into that experience. And, we think about just treating the person with Parkinson's and their symptoms related to that, and integrating that with what other treatments they're seeing. But the care partners also need to take care of their health and their well-being. And so I appreciate you bringing that in and maybe encouraging them to also consider supplementing what other things they might be doing for themselves. There was a question earlier about cupping, and we didn't really get to that. So could you talk a little bit about cupping, and is that something that you would do with someone with Parkinson's, and what would it help?
Well, yeah. So short answer, yes, I do cupping. It is absolutely a clinical modality used in Chinese medicine, and it is extraordinarily effective. It is also widely abused right now, in my opinion, because again, if you don't understand the underlying principles behind Chinese medicine, and you don't understand when there would be contraindications to cupping, you can be quite dangerous, right? So we talked about phlegm, right? And it can be this insubstantial thing. You generally don't cup over phlegm. Now, phlegm is not necessarily, in this context, the stuff that you cough out when you have a cold, right? And so, you could, cupping can be contraindicated. There's times where you just should not do it. For many of my Parkinson's patients, they are at an age where there are plenty of reasons not to do cupping for them. Everything from the health of their skin to the health of their underlying structures. So like you don't ever cup over major arteries, right? Because these, when you put a glass cup on somebody where there's a vacuum that's been created, the ability to pull tissue up and away, we typically do it in Chinese medicine as a way to extravate stagnant blood. And stagnant blood could be something like a blood clot to the Western mind, or it could be this, just a sensation of a sharp pain somewhere in the body. Both to the Chinese mind would be blood stagnation, and both require treatment. One, you should probably treat with cupping because it's going to be relatively effective. The other, you should probably treat with blood thinning agents, and quite frankly, maybe need to see a cardiologist. Take your pick, because one of them might kill you, right? So there's times that cupping is absolutely an effective quality modality, and then there are times that it is. You look at Michael Phelps during the Olympics, and the dude for sure had loads of blood stagnation because of his status as an athlete. Where it was presenting both as chi stagnation, so a dull ache, and then sharp pains and things like that. But my guess is that in China, where they're like, no, that's medicine. It's not a trend, buddy. They're probably laughing at us over that one. But maybe not. Maybe they were like, hey, they're catching on. Could be.
All right, so you talked a little bit about just now about integrating the Eastern and Western, and we're getting questions from people like, how do I find someone like with your beliefs that's well-rounded? And so I guess I'm going to go to, how would you tell our audience to approach integrating Eastern medicine, Western medicine, especially if they have maybe a healthcare provider that is a little hesitant, maybe doesn't embrace that idea as much? What would their best approach be?
Yeah, so best approach is the evidence, right? There has been more research conducted on Chinese medical treatment modalities in the last 20 years than it's staggering, right? Like if you were to check out PubMed and see the number of studies that have been done, it is astonishing, and it's not just a handful of RCTs here or there, randomized control trials here or there. It's not just papers that were submitted as a case review or something like this. These are like high quality meta-analysis and systematic reviews, so that the absolute pinnacle of the evidence pyramid. And so if you have a provider who is just insisting, nope, Chinese medicine is all just a hoax, it's like, well, then it's a 5,000-year-old hoax, first of all, or more. And secondly, you have a lot of reading to do. Now, typically when you tell your physician you have a lot of reading to do, they're like, man, I'm already doing a ton of reading, like chill out, like give me a break. But there's a lot of reading to be done for sure, because the amount of evidence is just overwhelming at this point that patients have better outcomes when care is integrated with conventional care. So like Chinese medical modalities or Eastern Asian medicine modalities are integrated with conventional care. I would also submit that many of the times that I've come across physicians who are a little bit reticent to look at Chinese medicine and kind of give it an opportunity to take a peek, they've had a really rough experience with it here or there, because they had a patient who had come across one of these charlatans that is out there in the profession. I think that we as a profession are getting much better at regulating and self-governing that, and through mechanisms of proper and effective licensure throughout the various states and territories, through the as well as through the NCCAOM, which is the National Certification Commission of Acupuncture and Oriental Medicine. There's very good standards out there for what it takes to become a doctor of Oriental medicine or a licensed acupuncturist. So if you're able to find somebody who is appropriately credentialed, and have them talk with your physician. And there's very good programs right now on this as well. Like, so the doctorate degree that I just completed through Pacific College of Health and Sciences, that program was phenomenal at getting practitioners in my field to be able to integrate with practitioners in Western fields. And so if you can find somebody that has a doctorate of acupuncture and Chinese medicine, a DACM, they may not be licensed as a doctor of Oriental medicine, but they have a professional doctorate, which is a very, it's an accredited degree, and it's a good program. Your probability of success with somebody of that caliber is going to be much higher, as well as having them integrate with your biomedical physicians. So that would be, and I mean, I really believe in building bridges, right? Like we don't have to I'm not here to compete with Western medicine, not even close. I'm here to integrate with Western medicine. You might even say, I heard this once before, and I don't know whose line this is, but I don't want to plagiarize it. So it's not my idea, but I love this. We are here to complete Western medicine, right? And that notion of that integration, where we are building bridges between Eastern and Western worldviews of the body and how to heal, I think is really the way forward. So, if you can find somebody, if you've got that physician who's maybe a world-class neurologist and they're just like, I don't believe in this, I'll talk to them for you. I'm happy to do it.
So, and I know people are wanting to know, is there a place they can go and get a listing of those who are actual doctors of Oriental medicine?
Yes. So the NCCAOM website, which I do not recall offhand, I think maintains a list of diplomates of acupuncture and Oriental medicine. So basically, who has passed the board's process, which are quite rigorous. These are not easy tests, right? They're very rigorous, and the NCCAOM maintains a log of that. Each state should have a mechanism by which you can check a practitioner's license. So it's a really easy matter to just check if I've got my license, for example, or another physician does. So you can check there. I hope I answered that question. I did see that Caitlin asked if there's a book to recommend. I would say the best book for someone new to Chinese medicine would be Ted Kapchick's book, The Web That Has No Weaver. It is phenomenal. It does a great job of sort of demystifying this medicine, demonstrating that it's logical and coherent throughout its practice. And actually, I think that might be a phrase that Ted uses in his book, actually. Maybe I should call him Mr. Kapchick or Dr. Kapchick. But the guy that wrote the book, just a fantastic book. And it's actually the book that I prescribe, if you will, to Western physicians when they're kind of trying to get into this medicine and understand what it is. That's the best one. Ted Kapchick's The Web That Has No Weaver. fantastic book.
Fantastic. This has been so wonderful. We did have a good point from Susan. She said, I'd never considered it before, but the Chinese themselves appear to integrate their traditional medicine in more modern medicine successfully. The example was given a vaccine against COVID. Many of them are vaccinated against COVID.
Absolutely. That's a fantastic example. My understanding of Chinese hospitals is that they tend to have a Chinese medical wing and a Western medical wing, and that the two systems integrate very thoroughly. At the earliest stages of COVID, if you contracted COVID, you went next door to the TCM wing, and you were getting daily acupuncture, often twice a day. You were getting herbal formulas, which contain things like Huoshang, which is basically like a agastache or patchouli would be like, I think those are the English terms for that herb, along with a bunch of others, and they were having very good effect. So much so that like they started to record like, hey, look, this is what's happening on this patient's tongue, because that's a pillar of how we diagnose, is through observing the tongue and palpating the pulse. And Western physicians started to look at that, and they started calling it COVID tongue, right? Where they were seeing like these like geographic peeling and landscaping of the tongue. And it was like, oh my gosh, this is so cool. And in Chinese medical realms, we were like, oh, they're getting it. But the integration aspect in China it vastly exceeds what we're seeing here. You won't find me praising, much out of China, but their medicine is fantastic, right? But again, go ahead.
I was going to say, we also had someone who said they have been treated by Chinese medicine practitioner, and they feel like it has definitely slowed their progression.
Yeah, I saw that. Was that
yeah,
you? I think I saw
Martha Jaffe, who wrote that. And I know people were wanting to know, like, how many people in China have Parkinson's, and
well, I mean, I guess it depends on diagnosis, right? Like if I was in China practicing Chinese medicine and you came to me, I wouldn't diagnose you with Parkinson's because I don't care, right? That's not how I view it. I would just diagnose you with wind, right? So maybe the answer to the question of how many in China have Parkinson's, maybe the answer is 0, right? Because they might have one of the 6 or 7 different descriptions of a wind pathology. Now, how many have the shaking phenomena that we here in the West identify as Parkinson's disease or any movement disorder? I don't know. Billion something people over there. There's probably a pretty good amount of them that have it.
Absolutely. All right. Well, this has been extremely helpful, and I hope everybody has enjoyed it. We have dropped some of those links in the chat, so you can get the book that he was referencing. There's also the link to the NCCAOM, where to find a practitioner directory in there. So if you want to save your chat, if you go down to the bottom of your chat box, there's the 3 little buttons, and it says more. And if you click that, you can save chat. And if for some reason you dropped off, you came back in, there was things that you missed in the chat, if you email us at info@pmdalliance.org, we can get you a copy of that chat. That way you don't miss any of that information. Dr. Bibeau, it's been really a wonderful conversation. I know that we could probably spend several hours kind of like delving into some of these specifics, and I know there's probably a lot of questions that we didn't get to.
I mean, we just scratched the surface. Like,
yes, I'm sure, but it's been so wonderful, and I want to thank you so much for your time and your expertise. I want to thank everyone for joining in. And if you do have any questions that are really, really just burning and you want to know the answers, if you write them in, we might be able to ask Dr. Bibeau to give us some insight into that, and maybe get that out to everybody. But if everybody would be willing to give Dr. Bibeau the wave of gratitude, that's something we do to everybody. As we thank them for their time and expertise, we're very appreciative of this, and for everyone joining us. So thank you very much. I hope you all have a fantastic day.
Thank you. Thank you for the opportunity to share this with you all. I really appreciate it.
Absolutely. Have a wonderful day.